Hi, welcome to Pathology Riddles. The topic for today is what is Marfan syndrome. It is a connective tissue disorder affecting mainly the skeleton, eyes, and cardiovascular system. 70 to 85% of the cases are familial, that is, they are transmitted by autosomal dominant inheritance, while 15 to 30% occurs by new mutation, that is, sporadic cases. Let's talk about pathogenesis in detail. The defect is in fibrillin 1, which is an extracellular glycoprotein. The defect occurs due to mutation in FBN1 gene, which encodes fibrillin 1 glycoprotein. Let's see where is fibrillin present. For example, when we consider heart as an organ, it contains cells and extracellular matrix. One of the structural components of extracellular matrix are the microfibrils. The major component of microfibrils are the fibrillin. The fibrillin acts as scaffold which holds elastic fibers together and controls our range of movement. When fibrillin is abnormal, there is excessive elasticity. The microfibrils are abundant in aorta in cardiovascular system, ciliary zonules in eyes, which are the supporting structure of lens, and our ligaments which support our skeletal framework. Hence, these structures are predominantly affected. Fibrillin has two homologous forms, fibrillin 1 and fibrillin 2, encoded by FBN1 and FBN2 respectively. Mutation of FBN1 causes abnormal fibrillin 1, which affects heart, eyes, and skeletal framework, which are manifestation of the Marfan syndrome. There is one more mechanism involved in Marfan syndrome. Normally, microfibrils sequester TGF beta cytokine and control its behavior. In Marfans, there is a loss of microfibrils. The result is that abnormal excessive activation of TGF beta. The excess activity of TGF beta breaks down proteins of extracellular matrix. The mechanism is responsible for few structural alterations like myxoid changes. Coming to morphology. Patients are unusually tall in height and extremely long extremities. As you can see here, the arm span is more than height. The patients have long, tapering fingers and toes. Unusually flexible joints, like the thumbs, can be hyperextended back to the wrist, or the thumbs jets out when enclosed by fingers. They are also long-headed or dolichocephalic, with frontal bossing and prominent supraorbital ridges. Kyphosis, scoliosis, and slipping of dorsal or lumbar vertebra are few skeletal defects along with pectus excavatum, which is deeply depressed sternum. Coming to eyes, the most characteristic ocular changes include bilateral subluxation or discoloration of lens. That is, the lens is displaced outwards and upwards. The cardiovascular lesion include mitral valve lesion and ascending aorta dilatation. Loss of connective tissue in mitral valve makes it floppy, along with lengthening of chordae tendineae, which gives rise to mitral regurgitation. In aorta, the medial layer loss along with increased TGF beta signaling causes dilation of aorta, intimal tear, and which can cause intramural hematoma leading to aortic dissection, which causes death in 30 to 45% of the cases. The important part to know is all the patients don't have all these clinical presentation. Some may have skeletal lesion predominant, while others may have heart lesion predominant. Clinically, they are diagnosed by revised GENT criteria, which involves family history, cardinal clinical signs, and fibrillin mutation. The treatment is mainly beta blockers, which acts by reducing the heart rate and aortic wall stress, while more treatment modalities are being researched. I hope you have understood Marfan syndrome. Do ask questions in the comments below. We shall be happy to reply. Do subscribe for more and like if you found it useful. Here is Pathology Riddles signing out until we meet in the next video. Goodbye.